Meeting of the Community and Health Services Standing Committee to order. Miranda, can you do roll call, please?
Yes. Miller. Here. Engel.
Here.
Kramer.
Here.
Glassberger.
Here.
McGuire.
Here.
Barris. Braithwaite.
Here.
Chicker. You have 7 votes.
Okay. And are we in compliance with the open meetings law?
We are.
Thank you. I would take a motion we have an 11-point agenda for approval of that agenda.
So approved.
Thank you,
Second.
Francis, and second by Sandy. All those in favor, please say aye. Any opposed? Okay, did you guys get a chance to look at the minutes? And are there any comments, questions, changes?
I have none.
Okay, we'll declare those approved and move on to number 6, public comment. Is there anyone here from the public who wishes to speak? Okay,
I have one thing.
Yeah.
My donkey schedule is out. It was in the paper and it's supposed to be, and Roxanne put it in the next, their flyer that they put out. So, yep, start Memorial Day. Here we go.
all right.
So,
What's the donkey's name again? I forget.
Miss Purdy and Nestor.
Thank you.
You're welcome.
All right, well, before we go to number 7, I just want to welcome Larry Engel to the board.
Thank you.
So yeah, this is a great time for you to be on here too, because we have our annual report on Health and Human Services. So you'll get to have an overview of the departments. We'll move on to, well, and also, I'm gonna steal your thunder a little bit.
My daughter, okay, that's all right, I'll cross that out.
Welcome to our new director. Say hi.
Yes, so I was an interrupted, threw my hat in the ring, and so I will be the permanent director pending approval by county board on the 20th, so
Congratulations.
thank you.
Okay. So number 7, this has been open for a while, election of Community and Health Services Standing Committee Vice Chair. Sadly, when Marty passed, that was vacated, and it had took a while for us to get a seat replaced on the board. Now we have Larry here. However, on this committee now, we also have a second resignation. So Michelle Harwick put in her resignation. So she would have been another board supervisor on this committee. So I did discuss with these guys if we should wait, but it's been such a long time since we've had a vice chair. I think we'll just go ahead and do this. And then hopefully within the next couple months, we'll get another member of this committee on here as well. So, how we've done this in the past is I will just open it up for nominations. A nomination would need a second, and then we can vote on that. If the person that's nominated wants to decline, they can do so, however. So, we typically have not done this by ballot, like writing or anything, it's just voice. So, it does have to be a member of, it has to be a board supervisor, so it can't be a community member that's on this committee. So that's just the rules about that, I guess. So with that being said, I will open it up for nominations for our vice chair. Yes,
I think Sandy would be good.
I would second that.
all right. So we have a nomination and a second. Do you have any? Yes,
I'm sorry, that was second by.
Larry, Mr. Engel. I don't remember, do I open it up for more or do we just?
I think probably.
Yeah,
Three
I
times.
think I wait 3 times.
3 times altogether.
Thank you for reminding me. It's been a while. Okay, so any more nominations? Any other nominations? Then we will vote. I think we just go by approval, correct? Okay, so all those in favor of Ms. Kramer as vice chair, say aye.
Aye.
Any opposed? Okay.
Good.
Congratulations, Ms. Kramer. I should have asked you, are you willing to? How did you win? Would you like to decide? Okay. All right.
He's used to doing that stuff.
Okay, sounds good. Got that taken care of. All right, so now number 8, reports. If you guys are okay with it, we're going to move the child support agency report to the top so they don't have to sit through the rest of it.
Oh, well, thanks. I
Yeah.
appreciate that.
Okay,
All right, so the report is for the first quarter of 2025. And you'll see in your packets, our performance measures for January through March are listed. Unfortunately, for the collection of current child support for February and March, we did fall below the benchmark. And then the arrears collection, we're still below the benchmark, but that's the measure that starts over at 0 on the 1st of October every year, and we have until September 30th of the next year to build up to that 80% benchmark, which right now we're at 72.36. So we anticipate we'll easily in the next couple of months meet our 80% benchmark. So I did kind of go back and look and see if I could evaluate some trends of why we had a little slump in our child support collection. We do have an increased number of non-custodial or paying parents who have been incarcerated. We've seen an increased number that are entering treatment centers. And when that happens, we have to put a pause on their child support. We can't enforce it, we can't collect it. So we get dinged on that. The second thing is if a paying parent moves to another state and they're not paying their child support, we actually have to file paperwork with the other state and ask them to help us enforce the order. Because in Wisconsin, I can't issue an order in Wisconsin to have somebody in Colorado arrested. It doesn't, but I can reach out to Colorado and say, will you please enforce this court order for us up to obtaining a warrant and putting them in jail. The problem is sometimes the other state cannot get the enforcement measures done either and get that parent to pay. Wisconsin gets dinged for that, even though we have turned the case over to another state. So those are kind of the two trends I've been seeing. We've been trying to pull reports and really stay in contact with those other states to see if there's anything that we can offer them to help with their enforcement measures. As far as training, I did complete my new director training. And then I have some bi-monthly leadership meetings that I do virtually. And then over the summer and into the fall, I have some in-person meetings that I'll be attending. Charlene, she's finishing up her alternate care training. That's for kinship and foster care placements. We do child support orders for those. She'll be finishing that in June. Otherwise, we have all of our required training for the year is completed, but we constantly look for new opportunities as they become available. For the budget reports, those are as of March 31st. We still have 79.12% of our expenditure budget remaining. Unfortunately, we don't show any revenue yet for the year because I claim monthly, but the state only pays us quarterly. So we did get our payment on the last day of April for the first quarter. So that'll show up on the next time I come and do my reports. And then just some miscellaneous items. I'm currently working with administration to develop a job description. There has been a part-time position for our office, has been on the books the last couple of years. But I don't know why it was chose not to fill it at the time. I do feel we have a need for it. So I've been working with administration to develop the job description and the pay scale for that. The Department of Children and Family, they're doing a large-scale data cleanup in preparation of our new computer software. We did receive a list of cases that require cleanup. Fortunately, our county only received a list of 7 cases. Put that in perspective, Dane County received a list of over 900 cases that they have to clean up. So 7 wasn't too bad, and they're done. Most of ours were where one of the participants, either the payor or paying parent, it was determined that they're deceased. So then we just have to do file some court documents to clean the cases up. So our data cleanup is done at this point. Attorney Forehand and I participated in the Get Real event up at the high school. That was my first time participating in that. I think that is an amazing program they offer to the kids up there at and the surrounding school districts. I think it was a shocker to some of them when they came to our table and we were like, oh, you make this much money? This is how much you have to pay in child support. And they're like, no, hey, yes, every month until your child turns 18 years old. So I think a few of them had a little reality check of, this, and I kept saying, this is adult life. This is why we do this event, so. And then as far as our new computer program, there is a modernization program is what it's called. They're upgrading our computer program. Our computer program right now is an MS-DOS program circa 1995. It is very antiquated and difficult to use, so they are anticipating our new program should be rolled out to counties in 2027. It's gonna be called Thrive. And they've been giving us quarterly updates. They're, one of the big asks from agencies was, you need to let us know ahead of time for budgetary items, if there's anything that we're gonna have to budget for that we need. And at this point, they're telling us for our 2026 budget, they do not anticipate there's anything additional we'll have to budget for right now, but will probably be for 2027. So again, as I get that information, I'm relaying it to administration, MIS, anybody else in the county. I think that it needs to be applicable. So we're all on the same page when it comes time for our county to have this new program rolled out. So, and that is all I have. If anybody has any questions, I'd be happy to answer them.
Thank you. Anybody have any questions for Melanie?
When the collection of current support falls behind,
Mm-hmm.
what resources does the family have?
What resources do
Yeah.
they have? So they're basically just losing out on that money. It doesn't affect any of their, any benefits they're receiving, say like public assistance benefits. It doesn't affect anything. It's just that they're losing out on that money. And again, we always try to make the parent receiving the money aware of the parent paying you, they've been incarcerated, they've entered a treatment center, they've moved to another state, we've had to get that other state's assistance. We always try to keep that parent in the loop about what's happening. And I mean, unfortunately, there are times that it just comes down to that, you can't get blood from a turnip. So
Any average money that would not be collected per family would be about what?
it varies. It all depends on income. It can be anywhere from there's minimum wage guidelines, which for one child is $187 a month. The kid that I sent to another state where the father is ordered to pay over $2,000 a month in child support. So it just varies. It depends on the parent's income.
Can I ask, does the state legislature throwing out the budget yesterday have anything to do with how you run your business?
We have not heard anything, from what DCF has told us. There hasn't been any cuts to funding for child support. But they said they would update us if anything came down the pipe, but right now, no. We're just gonna keep flowing along as usual, so.
Thank you.
Great.
Can I speak to that question? If they go 30 days without their child support receiving it, we can adjust public assistance
Okay.
To cover that 187 gap for the
to,
lowest.
it's not dollar for dollar, but we can count lower income for them to potentially get them a higher food share amount.
How often do you do that?
Whenever they call in, it requires them
frequently?
to report it.
Pretty frequently then?
Well, it's hard to say. I mean, as long as they report it, that's the big thing. If they don't report it to us, we don't know.
Well, and I don't
Thank
think
you.
you guys aren't getting all the calls for Richland County. They call the
Right.
consortium and then they
And-
they send them out to whoever the next available,
Right, so we're getting calls from 8 counties.
right?
So I wouldn't know for sure. Richland specifically, how many.
Thank you.
Great. Thank you very much.
Thank you.
Reports. So HHS Director and Admin Report, that would be Miss Stephanie Roundabout.
Sure. So the unit updates were in your packet. I did kind of bold some things that I thought were kind of, worth, pointing out. ADRC, they're doing their third annual 3K, 5K wellness stride. So, that's exciting, 3 years in a row for that. Then last month they held a volunteer appreciation luncheon. ADRC relies heavily on volunteers for their transportation and nutrition program. So it was exciting to recognize volunteers in the behavioral health unit. You can read through, I won't read through line by line, but I did want to highlight they had Mary Stoll start as their new recovery services coordinator. So it's exciting to have that person in that role to help connect people with addiction, connect them with resources. Child and youth services highlighted, they've had some reunifications, so that's exciting. Kids back with their biological parents. For economic support, they celebrated Economic Support Specialist Week. Actually, they're getting to get celebrated twice. They got celebrated as a consortium, and then the state just sent out Governor Evers sent out an announcement recognizing economic support specialists. And of course, public health was recognized as well last month. So everything there, as far as all agency, as far as the entire building, I think the only big thing is everybody's in the financial unit, we're starting to use the new Tyler financial system. And as far as employees, the payroll is now running out of Tyler. So that's been working, and they set us up with our new employee portal. So employees are starting to use that as well. So that's exciting. And I guess we have a vacancy in the finance and business manager position.
And you're
So
currently still
just talk to Megan and get Justin the ball rolling on that today.
Okay.
So I'm doing both right now. So I know.
Bless
It's
you.
okay. It's all right. It's all right. Questions?
So you said the Tyler implementation or rolling with that it's going well now that you're fully,
For our unit.
Payroll?
Yes. Our
Yes?
unit, yeah. we're happy.
Okay.
I don't think there's anything, a few little glitches that we had to
Yeah.
fix, like, I think they must have done an import from the old system, so we gotta fix some profiles and stuff, but otherwise, I think everybody's able to see their pay stubs for the most part.
good.
Go from there and review balances. So it's exciting.
Great.
I won't go into much detail because we got annual reports, so.
Yes, okay.
Have a really big.
Larry, before I forget, do you have access to you checked my words are escaping me today, the folder for today's meeting? You have access to all of that? Okay,
Yep.
great. All right,
I also had an orientation by those two.
great. Thank you.
Yeah. You have some money questions for the most part.
All right, so B is our expenditures report. So this is typically, we just it's a view, and then if we have questions, we can ask. Or if Stephanie has any, notable things to mention.
Just if you scroll down and look, it looks a little different this month.
Yes, it does.
That's mileage reimbursement, but this portion here, this is actually a report out of Tyler, the new financial system. So, hopefully it's still very similar. You got your vendor and you got how much we paid and that. So, but I think just being straight across with it along these rows in an Excel spreadsheet, it's a little easier to read than the other reports. So, but yeah.
Okay,
But yeah, nothing otherwise. I don't think there's anything that really jumped out.
were there any questions for Stephanie on the expenditures? Okay, then C is the HHS budget summary and then the Richland County placement report. Again, we typically just kind of have an overview of that, and Stephanie mentions if there's anything notable.
Just notable that you're probably thinking we have a pretty big surplus for only 3 months in. I kind of reviewed that and looked, and what I did was I estimated some CCS revenue, But I did put in the anticipated expenses that kind of go in and offset that a little bit. Plus two, what I'm doing is I'm prorating the tax levy, a portion of the tax levy into that as well. So typically we don't officially tap into the tax levy until later in the year. So, so that's kind of what's reflecting in this, surplus. So I would not bank on that dollar amount at this, 25. But otherwise, we should be at 25% utilization, and on average, we're at 20%. So all programs look good right now.
Okay. And then the placement reports. So is the Fund 44, are we at higher utilization than normal with that? It says it's 30% utilized through March.
Yeah, so we should be at 25%. Yes.
We have some
I have to compare I have to look at last year this time. I think there's a couple of high placements. We have
Is Fund 40, we usually utilize is it Fund
Fund
44 that
44.
we do and then 54 has to, okay.
Correct. We usually use all of 44. It's been a long time since we haven't. so,
Right.
But
I just didn't know if there were any changes recently.
institutional is really high
Okay.
this year. It hasn't been that high. Because we had the one Shalita drop off, but now we have somebody in, where do we have? Bakari.
Is that new? I don't remember hearing that name before.
So I think that's probably why it's a little higher than normal. We might, yes.
I think we've also had an increased number of youth that have gone to Winnebago. And those fall on this form.
And typically, like, as you can see, there was 21,000 in revenue, so, the revenue is always kind of a little bit behind, so.
Yeah.
Some things covered by insurance.
Any questions from the committee for Ms. Renfelt on any of that? Okay, if not, we're gonna move on to our HHS 2024 annual report. I just want to say thank you to all of you for coming and taking the time to do this. I know you guys are busy. I will say as a committee member, this is one of my favorite times just because I think it's such helpful information and especially for newer members to put faces to names. It's great. So I appreciate it. I don't know how you guys have it worked out, but if you don't want to stay the whole time after you give yours, if you're okay with it, they can head out, or if you want to stay in here the whole thing, that's fine.
Support your teammates.
Yeah. I just don't want you to feel like you're chained here, but
You're good.
anyways, I really appreciate it. Thank you, guys. Great.
Okay, so, yeah, I can start, from the director, which is really actually from the previous director, she was the director in 2024. You can read through her highlights, read through the highlights. But I think, was there anything you wanted to point out that they're not gonna talk about in their, I think just 2024 was just another year of just working hard and, promoting the well-being of the Richland County residents. So should we just start right in the beginning and work our way to the table of contents? Does that work for everybody? Do that.
You're the boss now, you can do this.
I'm the boss. All right, well, that's what we're gonna do. We're gonna start in the beginning. So then Administrative and Financial Services Unit, so as the Business of Financial Services Manager, this was my unit. And you can see the listing of all of the different support services we provided. Anything from doing the accounts payable to contract.
To interject, by the
Oh,
way, sorry for anybody who's following along. I think
I'm
we're on
page 9.
page
Page 9, I'm sorry. Yep, page 9. Thank you. So sure, so you can see all the bullets of all the different support services provided. It's really, that's what they do. They just support, the internal team and the external community, with walk-ins and answering phones and if managers have special projects, they'll go to them and have them help with those things. So they kept busy with all of those things in 2024. Some highlights were that we talked about the financial system a little bit earlier. They, the admin and financial services unit, were a big part of the beginning rollout of that, some of the planning and the configuration and that kind of thing. Full rollout, obviously, in 2025. Human resources functions, we still had some of those, even though it's been centralized, it's not completely centralized. So there's still some of those tasks that we do. The year before, we did a full rollout of the Engage module in our EHR, which has been super helpful in reminding clients about their appointments with the therapists and the doctors and things like that, which isn't something we did before, but it was all very manual, making phone calls, sending out letters. So now the system does that, and the system also allows patients to complete paperwork ahead of time before appointments. So that's been pretty successful. I think if we jump down, financial interviewing was something that we really have increased the process in that, doing more insurance, getting the insurance information before clients are seen has been super helpful. And you can see since we really started to do more financial interviewing, our write-offs have reduced quite a bit. So that's been super helpful. Let's see, and then the next 2 pages, 3 pages, the next 2 pages, page 11 and page 12 are the financial summary, our core expenses, our core revenue. As you can see, we ended up with a surplus in our core budget. I would say primarily due to really good WIMCR reconciliation reimbursements, almost $1 million in just WIMCR. WIMCR is Wisconsin Medicaid Cost Reporting. Try not to use acronyms.
Yes.
but-
Can we get a new, actually, didn't we make
We go back to
the
the
acronyms?
expenses for a minute.
Did you show them where those were? Or I'm trying to remember, are they in the,
Are you entertaining questions now, or you want me to wait until later?
oh, it's in our, okay.
That's fine, I can answer questions.
So, really quick, Larry, just as a point of information, because there are so many acronyms that get thrown around in this unit, we actually created, I should not say we, I did not do it. Was it you, Tricia?
We.
Okay, these lovely people created an acronym list. And so if you go to the main folder for community and health services, it's in a PDF at the end. It says HHS acronym list. And there's also the org chart there as well. But those are both helpful to kind of have on hand as a reference. I still sometimes will get thrown by an abbreviation. I'm like, wait, what was that? Okay, so I'm sorry to interrupt.
He was just asking if he could entertain questions now, or should we wait till the end, or
I think maybe at the end of each
section?
Yeah.
Which I
section.
don't have much left in my section. I mean, honestly, it's the expenditures and revenues. I did the same for the placements, a surplus there. And then on page 13, we just give a list of the expenditures for contracts that we had over $10,000. So, and a lot of these individuals that we contract with were 100% reimbursed through like the comprehensive community services program and our children's long-term support program. So, but we just hold contracts on those. So that's my section. So yes, questions.
This was for both the incoming and the outgoing director. If you look at the core expenses there, if you had a wish list, top 3 where you needed more resources, what would it be?
Jeez.
I think agency-wide crisis APS would be one. Number 2 is probably in public health.
Can you say it again?
Public health, I think it's a very small unit. There's just 3 of them there. I think they're able to get by meeting mandated services. I think there's a lot of other services that could be provided. And I think it would be great if Brandy could be more of the manager role instead of a working manager. So public health would be 1. Adult protective services and crisis would be number 2. Those numbers have greatly increased over the past couple of years. I think for adult protective services, it has almost, and you can correct me if I'm wrong, tripled.
Triple?
Tripled. And so that is definitely a spot that additional support would be needed. I think wish list, huge picture, and I don't know where this would be. I think it would be great if we could have a community support program. So CCS is that level where people are in the community and really with a little bit of extra support can function well if they have mental health AODA issues. Community support program is that next level up where it really is almost intensive daily contact with individuals to help maintain them in the community. So I think those would be my wish
And we don't
list.
have that currently.
We don't, it's a 60-40 split so that the county covers 40% of all expenses and Medicaid covers 60%. There is discussion across the state to potentially make that 100% funded through Medicaid, but we also have all the stuff going on in the federal level of potentially making cuts to Medicaid. So that's one of those that we really don't know where that's going to fall, but I guess that would be off the top of my head without preparing for that would be my answer of what we would need.
We're just fishing for things to
Yeah.
focus on and think about.
Yeah.
Any other questions for Stephanie? Okay, we'll move on. As you guys go to talk about your unit, if you could just introduce yourself for the benefit of anybody who might not know you, that would be great. So it looks like we have, where are we at next? Did you have anything else on yours, Stephanie?
No, that was it.
Okay, behavioral health.
I'm Brandy Christensen. I'm the Behavioral Health Unit Manager. So behavioral health is set up really to provide a continuum of services for our Richland County residents. We cover anything from short-term crisis stabilization all the way through long-term case management. We have 9 different programs in our unit, and fully staffed, we have 18 employees and 3 contracted employees. So some of the programs in our unit, we have treatment court. Treatment court is an alternative to incarceration for nonviolent offenders in the community. They have some form of substance abuse or alcohol use disorder that was a contributing factor in some criminal activity. So those individuals are offered treatment court instead of going to prison. Richland County's treatment court has two separate courts. We have our sobriety court, and that's for people with alcohol offenses. And then we have drug court, which is for people with substance abuse offenses. The treatment court works together with a team of community different stakeholders of law enforcement, probation, the district attorney, the circuit court, to provide intense supervision, monitoring, and treatment for these individuals. So in 2024, our treatment court served 7 people in sobriety court and 8 people in drug court. Sobriety court had 5 graduations and drug court only had 2. There were 6 applicants for sobriety court in 2024 and 11 for our drug court program. Next, we have our outpatient clinic. So our outpatient clinic is where we have our mental health therapist, our substance abuse counselor, our psychiatric nurse. We have a contracted psychiatrist, a contracted psychologist, and a contracted psychiatric nurse practitioner. We do individual therapy, medication management, and different type of psychiatric evaluations. In our clinic is where we also conduct the intoxicated driver assessments for individuals who get DUIs in our county. And then we have our choices group, which is for underage offenders that got tickets. So in 2024, our clinic completed 63 intoxicated driver assessments, 54 mental health assessments, 32 substance abuse assessments, 22 psychological evaluations, 46 psychiatric assessments, and 11 underage youth completed our choices program. Our crisis services, they're set up to give an immediate response to individuals suffering from mental illness and or substance use disorder in the county. During business hours, our crisis is staffed by a county employee from 8 to 4:30. And then after hours, we utilize Northwest Connections to conduct all of our crisis needs in the county. And And then I'm also contacted after hours if there's a need. In 2024, Northwest Connections had 379 contacts with Richland County Crisis clients, and Richland County Health and Human Services had 1,088 crisis contacts. So that's a total of 1,467 crisis contacts. One part of our crisis department is the emergency detention. So an emergency detention is when it has been determined by crisis professionals and law enforcement that an individual is a danger to themselves and or others, or they have significant mental health concerns to where they're not able to care for themselves, meet their basic needs. We then take them under an emergency detention. We take them to the hospital, they're medically cleared, and then we find placement for them at a psychiatric facility. They are held there for 72 hours until their court hearing to determine what next steps are going to be, or if it's going to be dismissed. In 2024, Richland County had 35 people emergency detained throughout the year. Adult Protective Services is another program in our unit, and they help elderly adults and at-risk adults who are being abused, neglected, exploited. APS can help with guardianships. We place individuals on protective placement. In 2024, there were 222 APS referrals. Next, we have our comprehensive community services. This is a program that's fully funded by Medicaid that helps individuals with mental health and or substance use disorders. The goal is to keep people in the community as independently as possible and prevent hospitalizations or group home placements for these consumers. In 2024, we had 76 people served in our CCS program, and 66 referrals were submitted. Within our CCS program, that's where we have some of our mental health residential services. This is where we place individuals in group homes because they're unable to remain independent in their own home and just need some support as a result of their mental health. And in 2024, we had 9 people placed in group homes. Next program is Children's Long-Term Support. So that helps children with disabilities and their families get connected to supports and services that help the child grow and live their best life at home in their community. They can provide adaptive home equipment, provide respite for parents that are caregivers. In 2024, 87 children were served in our CLTS program and 32 kids were referred. Then we have our Birth to 3 program, which is an early intervention program for children birth to 3 that have delays or disabilities. In 2024, we had 49 children served in our Birth to 3 program and 43 kids were referred. And lastly, we have our coordinated services team. This is for children who are involved in multiple systems of care, such as mental health, substance abuse, child welfare, juvenile justice. They have an IEP at school. And in 2024, we had 4 children served in that program with only 2 referrals. Some big highlights for the behavioral health unit for 2024 is it really was a year of relationship building with community partners for us. We've all kind of talked about the silos that we see like in Richland County. And that was kind of my goal when I came in, is especially for our crisis and APS department, to build those relationships with law enforcement and especially the emergency room, as we work so closely with them. And I think that's greatly improved since I started. I think sometimes our numbers are higher too because we're utilizing each other more. Law enforcement's reaching out to us, the hospital's reaching out to us. So it's really been a great collaborative approach this last year. Another big thing is we've had decently good staff retention for the behavioral health unit. That's not always been the thing. We've had a lot of people come and go, but right now, the behavioral health unit is fully staffed at 18 people, and at least 12 of those individuals have been there at least a year, if not longer. So that's been really helpful to our unit. And then the last thing I want to add is in 2024, we added a behavioral health supervisor. So the unit used to be structured as the manager, and then we had just a supervisor for CLTS and Birth to 3. We've since converted that supervisor position into just a whole unit supervisor. So that's been really helpful. She's no longer case managing, can spend some time with our workers, helping them staff, and then also helping with some duties.
And who is that that's doing that?
Lori Cooley.
Okay.
Any questions for me?
I just want to say thank you for that report.
It's amazing how many people are on this. Do you coordinate with the school at all?
Yep, so we get called out to the schools for crisis. We do a lot of our caseworkers in our children's programs will attend IEP meetings with them or help advocate with the schools. Our CST program, she's going in and talking about what different resources we have for them. But the main collaboration we have is we get called a lot out to the schools for kids that are struggling with their mental health. And we go out and assess them right at the school.
Thank you.
Before Northwest Connections came in, it used to be where they'd go out on a crisis and then call in the social worker. And then on the phone, make the decision about whether or not to incarcerate or put it. When this came in, the idea was that it was going to save money by getting people more professional help right up front early. And the police and the sheriff would really welcome that because they ran over their head many times with this type of stuff. So I guess there's two questions for you. One, what's law enforcement think about it in the program? And two, could it decrease the number of incarcerations?
I think law enforcement has really grown to appreciate what we're doing in our crisis department in terms of the collaborative approach. So law enforcement knows that they can contact Northwest to have someone assess the individual on site, either over the phone or Northwest also provides mobile responses. So they can come out and have someone on scene. But law enforcement also knows that if they don't agree with something they're doing, if they're still struggling, if Northwest is saying one thing, but law enforcement feels another way, they can call me and then I can also help assist and go out and respond to it. In terms of if it's stopped incarcerations, I'm not sure on that one, to be honest.
Just one more question. 1467 is 4 a day.
A lot. I was gonna ask that, has it gone up a lot?
Oh, yes.
Reasons for that?
I haven't the slightest. I can say last year we had 35 emergency detentions for the entire year, and I think we're right now at the end of April, we are at almost 25, 30 already. April was a rough month in itself. I think we had 12 people hospitalized. So I don't know what is causing the uptick in crisis situations and hospitalizations, but it's rising. That guy never thought I would see it rise. I mean, in 2023, we had, I think, 21 emergency detentions, and then it went up to 35, and we're already at that, and we're only 4 months in. And they're all warranted. Since April, all of the emergency detentions we've had, only 2 of them were dismissed. So we got all of these consumers to hospitals, to facilities, and the psychiatrist, the psychologist had said, yep, this is needed. Let's look at putting people on settlements and commitments to have the county monitor. I'm scared to see what the number is going to end up in December. We're spending a lot of time at the emergency room.
I was gonna say, I
See all the
you.
time.
And you're the, manager, so I don't know, do you feel like, I know you said you're fully staffed right now, but with the numbers like that, do you feel like it's adequate? Sorry, that's kind of a loaded question.
I do think there needs to be another APS crisis worker. I think I devote more of my time sometimes to APS and crisis than I do like to my manager duties. Just because, I mean, yesterday we got called out by law enforcement 2 different times. When I only have 1 crisis worker and the calls are coming in multiple times in a row, it's really just triaging and seeing if I can go, if Amber can go. We do have other staff in our unit, like Alice, our psychiatric nurse. She's trained in crisis, so she helps when she can. If I go out and Amber goes out, then Alice stays back and connects with walk-ins if they come in. But I think there is a need for more staff, especially if the numbers continue the way that they're continuing.
Right?
We don't have one therapist.
Yeah, we do have one vacant position right now. We have there.
We are still needing mental health therapist.
Is there a breakdown by age groups? Is it young people or?
Not that I am polling. I can tell you this year, we're seeing more young people come through crisis. Ithaca Schools is one we're getting called out to pretty frequently that we've worked with. But no, it really is just a variety. I think we've emergency detained more kids this year than we have in past years.
That's what the national trends are.
Yes.
I just want to add, I just did some recent reporting for financial reporting. And I had to split it out between adults and children. And so just doing off of our like crisis tracker was about, I want to say like a 60-40, like 60% adult, 40% children, or under the age of 18.
I mean, I've been a manager now for almost 2.5 years. And this was the first year I actually had to do an emergency detention on a kid. So they are happening. I don't know why. I don't know what the rest of the year is gonna look like. Summer usually gets a little bit busier. And then we still have the whole next holiday season where December is always our busiest month for crisis.
One other question I had, do you know, how many people have graduated from the treatment court in total since it started? 'Cause how many years has it been going now?
Sobriety court started, I think 9 years ago, and then drug court just started a couple of years ago. But no, I'm not sure off the top of my head.
I just know we've had a lot, and I just think it's a great program. So I'm glad it's continuing. Right, any other questions? Dan?
Thank you.
That's great. Thank you, Brandy. Aging and Disability Resource Center, Dan.
That report was hard to follow. So ADRC, we are part of a 3-county region. So we serve Richland County, Juneau County, and Crawford County is ADRC of Eagle Country, but this is just based on our local office. So we actually have 9 different staff that work in our unit, and they work with a variety of different programs and individuals. So we work with individuals who are aging over the age of 60, people that have physical or developmental disabilities, adults with substance abuse issues. We can do some small things with them, adults with mental health issues, and then youth with disabilities transitioning from the children's world into the adult world. With our programs and with our staff the way they are all together last year, we had 14,979 incoming calls for services. So we see a lot of people in our unit and they come from all walks of life. One of the things that we provide are ADRC specialists do information referrals, assistance, and options counseling. So we're the first point of entry for long-term support programs in the county. So individuals come to us if they're needing programs such as family care, and then we assist them through that process. Our ADRC specialists are that first point of contact when you come into the ADRC. So they're going to meet with an individual, sit down, talk with them about what their needs are, and then connect them with resources that they need to hopefully help them remain independent and in their own homes as long as possible. So our ADRC specialists alone received 4,721 contacts from consumers last year. So this could be a first-time customer or repeat customers as well. So publicly funded long-term care programs. So like I said, we're the intake point for the state long-term care programs. And so right now we provide information for family care and IRIS. There are other programs too that we do not provide in this county. So we do the eligibility determinations and enrollment into both family care and IRIS. It's a very complex process. It's not like a one-time visit with somebody. It's numerous visits, making sure that they are able to get into these programs. So what they do is they conduct what's called a long-term care functional screen, which will determine functional eligibility. We work with the economic support unit to help facilitate their financial eligibility. We provide enrollment counseling, and answering questions about the programs. And then we do the enrollments and make the referrals, to Iris, as well. And then we also, help individuals transition into those programs. And then we do a lot of advocacy, for customers who are having issues or concerns with their chosen long-term care programs. So last year, we did 85 functional screens and had 79 customers who, were enrolled in a long-term care program. Last year, for most of the year, I'd say about half of the year, I should say, we had 2 ADRC specialists because we had a long-time retirement or a retirement from a long-term employee. And so it took a while for us to fill that position. So normally we have 3 staff in that position. Our disability benefits specialists, so they serve individuals who are 18 to 59. They assist people with applying for disability. They also assist them with appeals. If they're having problems with any of their different benefits, they can help them with kind of going through that process of figuring out how to fix those. They do open enrollment and getting people enrolled into their Medicare Part D programs. They also assist with their Medicare enrollment for Part A and B as well. And then they meet with individuals individually. They help them through that process. And again, that could be numerous appointments for them as well. So in 2024, our disability benefit specialist, Jamie, actually started in April. So we didn't have a benefit specialist in that position for a couple of months, but those programs are so specialized, it takes a lot of training to get them up and running. So last year, she served 142 Richland County residents in receiving $658,000 in benefits. So when we think about that $658,000 in monetary impact, that's money people in our community are receiving and then they're spending here in the community. So since the beginning of the disability benefit specialist program in 2002, the disability benefit specialist has made a monetary impact of $17,920,000. So you think over 23 years, they've helped bring in over $17 million worth of income into the community. Our elder benefit specialist works with individuals who are over 60. She again filled, we have a new elder benefit specialist. She filled position that had been here for 39 years. So both of our benefit specialists came in, they're new, and they just really hit the ground running. Rose had actually been a benefit specialist assistant for about 1.5 years, so she came in with some good knowledge as well. She works with individuals that are over 60. It's a highly confidential program, so for Rose, she has a lot of federal and state guidance that she has to follow. But she meets with individuals to sign up for Social Security, help them apply for disability, help them with their different Medicare benefits, and then other things like housing and food share and a lot of different advocacy things as well. She does do quite a few appeals too. So for that program in 2024, she provided a savings to 333 Richland County residents and totaling a monetary impact of over $1.3 million. And that would be all her because Joanne retired January 2nd or January 5th. So that was in 9 months of Rose being there. The other thing with Rose's position is she does a lot of outreach. She loves to do outreach, but she is really boots on the ground out in the community, meeting with people on a regular basis and talking about her programs. And then she also does, like I said, a lot of advocacy as well in housing advocacy. We also have early intervention and prevention services. So we receive about $2,600 a year for our Title III-D programs, which is our, that's federal money. And in order to be able to provide prevention services in the county, we have a really robust partnership with Simon's Recreation. We could not provide the services that we do without them. So last year, we provided classes in partnership with them for Tai Chi, Strong Bodies, physical activity for lifelong success, and then the SAIL program, which is Stay Active and Independent for Life. These are all evidence-based programs that significantly reduce falls for seniors. So last year we had 46 seniors that were involved in those programs. Next program that we have is we have our transition services for youth. So we assist children that are coming out of children's programs and that may have disabilities from the schools. We work really closely with CLTS as well, with Brandy's staff. And so we assist those individuals with transitioning from children's benefits into the adult world. So helping them get into family care or other programs that will help best help them in the future. So we have one of our EDRC specialists that does this program. She starts working with kids technically 17 and a half years and older, but she does go to IEPs and things like that earlier. So that way we can get people enrolled into those programs by the time that they're 18. The next program, we have the Alzheimer's Family Caregiver Support Funding. So we receive state funding to be able to provide support to individuals that are caregivers for individuals who have dementia. So in 2024, we were able to provide $7,161 in supports to individuals. So this could be if the caregiver is just needing a break, we can pay for respite. We can pay for specialized programs for the individual. We can pay for some different types of assistive technology, things like that. And then, or even programs, maybe if a caregiver wants to be able to go to Simon's, they can't afford to do that, we could potentially pay for their memberships. That way it really is aimed at providing support to those caregivers so they can continue to caregive over the years. Our dementia care specialist program, we share our dementia care specialist with Crawford County. So they are actually a regional employee, but she is with us about 20 hours a week. And so she actually provides a lot of different services to individuals within our community. She does a lot of outreach, a lot of education to the community as well. She does individual consultations. She provides Dementia Live, which is a virtual dementia experience where you would put on headphones and gloves and goggles. For 7 minutes, you would then go be put through a set of different tasks. And then after that, you do a debrief. It's really meant so that you understand what it's like to live with, live a day in the life of somebody that has dementia. In 2024, Dementia Live was hosted in partnership with the Richland Hospital, providing 20 professionals and family caregivers with that experience. She also has done dementia capable crisis training for EMS and law enforcement. We do that regularly. We try to get out to EMS and law enforcement yearly. So she has done that as well. And then just a lot of different classes, such as a lot of different brain health classes, memory screens and things like that as well. Let's see. She also does our caregiver support groups, and she also started a new caregiver support or a new support group for people living with dementia. So that has started and that has grown. I think she had 2 people that were in it and now she's up to 5 or 6. And our caregiver support group also has grown from like 5 people to 12. So she has been continuing to do that. Next program is our Richland County Transportation Program. So that program continues to be very busy. We continue to provide our public transportation, which is our bus program. We have routes that go out to different areas 5 days a week if people want to do that, but we don't go if we don't have somebody to ride the bus. And then we have our driver escort program as well. So in 2024, we did 1,209 wheelchair trips with our bus. And then our driver escort program, we provided 4,006 one-way trips, and our volunteers traveled 196,736 miles, and they donated 5,602 hours of their time. So we just have a really great group of people that love to drive and provide these services. We're actually back to pre-COVID numbers.
Really?
So
Oh, that's
yep,
great.
yeah.
I know it was a struggle for a while.
Yeah, we're still struggling with having enough volunteers. So when I'm out with other counties talking about our volunteer program, and we have 20 active volunteers right now, they're all amazed that we have 20 volunteers. We usually have 30 to 35.
Wow.
So we're down. We now are actually declining trips more than we ever have in the past because we just don't have enough volunteers.
Okay.
So if you know anybody that wants to volunteer, they might need volunteers. We also provide the National Family Caregiver Support Program. So again, like the Alzheimer Family Caregiver Support Program, that really is geared towards supporting caregivers. So last year, we provided 26 local families with assistance through for services for in-home services such as respite, homemaker chore services, consumable supplies, things like that. So really, we're able to spread that money around a little bit and provide a lot of services. Our elder nutrition program, that is another program. So this is the second year that it's been in the ADRC. So for that program, we have our 3 meal sites that are in Germantown and Richland Center and also in Rockbridge. We rely very heavily on volunteers as well. For that program, we could not provide that program if we didn't have volunteers, and we are needing more volunteers for that too. So our volunteer drivers for Meals on Wheels, Richland County gave 999 hours of their time. On-site volunteers gave 2,620 hours of their time for a total of 3,619 hours. We would not be able to have the Rockbridge site without volunteers. That is 100% volunteer run. So we're very thankful to have that. So we have a total of 67 Meals on Wheels volunteers and 12 on-site volunteers at this time, but still needing more of that. And then, so for numbers as far as what we served last year, we provided 16,768 home delivered meals and 7,905 senior dining site meals. This was an increase for both programs, for our home delivered meals and our senior dining. Richland Center, just some highlights for each location. Richland Center meal site, the grab and go program continues to operate. The site averaged 5 to 10 grab and go meals and 15 to 25 congregate meals daily. And then our Cazenovia site, individuals were provided congregate meals every Wednesday, and 10 home delivered meals each day were delivered there. And then in Rockbridge, there was an increase in attendance. The site remained open 3 days a week. So the last thing is senior farmers market. So we receive senior farmers market vouchers. Those vouchers are for low income seniors. And so individuals can sign up for that through the ADRC. We have different, we go out and do outreach for that through the month of June. In 2024, we were allocated 215 sets of vouchers and 79% were redeemed. So last year, the vouchers were $45. And so, and it was a really high redemption rate. In contrast, Juneau County, they have about 11,000 more people in their county, and they only received 165, I think is what Gina said, vouchers. So if the more vouchers that we're able to get out there and for people to use, they generally will give us more in the future. So we were very fortunate there. And I think that's it.
Thank you, Roxanne. Yeah, it is.
So much
I
information.
love all
in a
this
short period of time.
information. It's so good though. Any questions or comments from committee?
You know, I think it's important if we put a map of the county to say where the meal program isn't currently, it could be, or needed.
Yeah.
Would that be?
Where would that be? I mean, our goal really is to be able to serve all the way out, throughout the county to all of our borders. And really, we just can't. We can't serve all parts of the county. For our home delivered meals, we deliver meals from 5 miles from the Richland Center meal site and out to Lone Rock, and then also to Cazenovia. But Rockbridge does not have home delivered meals. So right now, individuals can, if they need meals, they can come in and get frozen meals. But we just don't have the ability to be able to get to all parts of the county. It's just not feasible. That is in our aging plan goal, is to be able to add home delivered meals at least once a week in Rockbridge and then do frozens as well out of that site. But we really are, I mean, it's Viola, the hard thing with Viola, so Viola is a little different. So for years and years, we had a meal site in Viola. And back in 2017, we had to make the decision to close that because we only had like 3 to 5 people coming to the site. So the cost of that meal site was quite large. At that time, we had an agreement with Vernon County that we would provide home delivered meals to that part of the county and then also to Richland County. Well, now that's kind of flopped. So Vernon County is serving that border community. They're providing meals. So
Thank you.
it's tough. And unfortunately, the funding doesn't increase. So the federal government, unfortunately, that doesn't increase. We've actually seen decreases. So it's, you can only do what you can do with the amount of money that you have. So.
Our new the food provider, that's still going well.
It is going well overall. I mean, we've had some hiccups here and there, but no, overall, it's going well. Yeah.
Questions?
Well, then
Yeah.
there's parts too where they're put between a rock and a hard space, but as far as delivered meals, because you have individuals who live outside of that 5 mile radius for home delivered meals. And the best thing to do is just call the ADRC and see if maybe something can be worked out. Because that was an issue with my mother, still is. So, and the frozen meals, some of your elderly will talk about those frozen meals. Well, if I'm gonna get frozen meals, I just go buy TV dinners. They don't want a frozen meal, so. But yeah, just call the ATRC and each individual, it's individually, categorized. Everybody's different, everybody has different circumstances. And hopefully someday, they could extend that 5 mile radius, but funding is the biggest thing.
So we are going to Aging Advocacy Day next week, and one of the items on that is funding for home delivered meals. So Larry will be there. We're gonna let Larry do all of our asking. Because we can't ask, as employees, we can't lobby, we can give information, but our board members and.
That's why I'm bringing my wife.
Thank you, Roxanne.
Yeah, thank you.
Right, economic support units.
Okay, I'm Brianna Turk, the Economic Support Unit Manager. What our people do is economic support specialists determine eligibility for public assistance benefits, which include food share, badger care, Medicaid for elderly, blind, and disabled, and long-term care Medicaid, caretaker supplement, and Wisconsin Shares Child Care Subsidy. On top of that, which is a separate, we handle certification for child care providers in Richland County. So if anybody wants to be certified, they come to us. We are part of an 8-county consortium. And those 8 counties are Adams, Columbia, Dane, Dodge, Juneau, us, Sauk, and Sheboygan. So our workers can speak to a caller from any of those 8 counties. In 2024, we had 1 manager, 1 lead, and 13 workers. Due to resignations and a retirement, we mostly had 12 workers for the year. And you may be asking why so many? Well, in 2015, the consortium was given money to hire more workers. And they get more bang for their buck here because our workers are not paid as much as say in Dane County or Columbia. So we were able to hire more workers. And they hired 8 workers and 1 lead. See, the workers' job duties include the primary is staffing a consortium call center. They also carry a caseload of about 800 cases each. And they are also the on-call worker 2 to 3 times per month for the agency. So what that means is they are available for walk-ins and phone calls from the community. So if somebody comes in and has questions, there's someone that they can speak to. Or if they call and have questions, there's someone they can speak to. And in 2024, we had 1,021 contacts that way through the walk-in process. Let's see, the consortium handled 300,001 calls in 2024. Of those, Richland workers handled 31,892. Our goal is to handle 8.9% of all phone calls, and that's based on the number of workers we have compared to the overall number of workers. And we exceeded that by answering 10.6% of calls. See top of 26, page 26, caseloads. The casework is measured a little differently. It's not measured as in the worker completed this many applications. It's measured in tasks. So for one application, there are several tasks. So that's why the numbers seem really high. That's because there are several tasks in each job duty that they do. So the consortium, it's total handled over 1 million tasks, and we handled over 118,000. So that was at 9.8%, which we're still above the 8.9%. They also have timeliness standards that are set by the state that we have to meet. And one of those is the applications keyed. So applications have to be keyed within 30 days. And the state's benchmark is 95%. So 95% of those applications have to be keyed timely, which is within the 30 days. So the consortium exceeded that benchmark by hitting 98.2%. And we actually did a little better than the consortium as a whole. We got 99.2%.
Nice.
And a highlight is in June last year, we were 100%. So all of them were processed timely, which is really nice when you have that many workers. See, and they work very hard to meet those benchmarks. So starting with the programs, bottom of page 26 talks about food share program. In 2024, the average number of cases in Wisconsin was 370,134. And the average number of cases in Richland was 1,189. And food share brought almost $4 million to Richland County in 2024. And that's averages over 300,000 per month. And let's see, they come to our citizens and spent here. Let's see, top of 27 talks about healthcare benefits. In 2023, which is the most recent numbers out, Medicaid paid on behalf of 5,477 Richland County residents over $44 million. And that's an increase from 2022 of over $1 million. Let's see, caretaker supplement, what this program is this pays for, it's a cash payment for parents who are on SSI. So it gives them a little extra money to help care for their children. And in 2024, $33,550 was paid to families for 15 children. Let's see, on the bottom of page 27 is Wisconsin shares in the child care subsidy information. We had 38 families participate, and that was for 70 children, and the total benefits utilized was over 200,000 for the year. Let's see, top of 28, we subcontract with Dane County, they do our fraud. And because they're excellent, they have a whole unit dedicated to it. And let's see. Misplaced. Sorry. There we go. We had 38 fraud referrals or overpayment referrals created for Richland County residents. And that's over $9,000 in overpayments established. And then finally, we do handle the daycare certifications. We had no certifications in 2024, and we currently have no certified providers. We have 7 licensed facilities with 1 temporary closed. I'm not sure if Ithaca's back open yet, but they were temporarily closed. But we hope to change that now that our lead worker is now dedicated a portion of her time to being the certification worker. So we hope to go out and advocate, recruit some certified daycare providers. And that's, oh, another highlight is the end of unwinding. So hopefully you won't have to hear me say that anymore. The unwinding of COVID policies, that was ended in June. So we're back to normal policies and procedures for benefits. Any questions?
Thank you, Brianna. Any members? Yes.
A lot of programs.
Do you know with the daycare thing, I know that's been an ongoing issue for community, is there, I don't know, is there any like work on that on the state level or anything to make that more accessible?
Unfortunately, I think the federal government is working on cutting some funding for that. So they had a program called Child Care Counts, which helped licensed and certified providers by giving them money, because let's face it, they can't charge enough to bring in enough to pay for the good workers and the care that the kids need. So I guess they're talking about cutting that. So
Yeah.
to tell you, but I think there are definitely advocates that are advocating for that not to be cut.
So it says there's no certified daycare providers, but there are currently 7 licensed facilities. What's the difference?
Licensing is done by the state, and I believe they can have more kids under the age of 7, if I remember correctly. Certified is done by the county, and there's just some slight differences. That is licensed, they're licensed. So the state, I've received any calls I get regarding licensed facilities, I can then direct that to the state. I don't go out myself because they're licensed and not certified. But I can forward information onto the state.
Other questions? Thank you, Brianna. Child and Youth Services Unit.
I'm Brittany Worth, the Child and Youth Services Unit Manager. The unit is made up of 4 case managers, a family preservation worker, and a youth aid worker. And our unit works with children ages birth to 18 years of age, and sometimes that can, we can work with individuals that are over 18 in certain circumstances. And CPS, which is Child Protective Services, really works with kids who have been abused or neglected. And we conduct investigations regarding those if it warrants that, we utilize our state statutes and standards to determine if that warrants that. There are times when investigations are not warranted, and we offer services that are voluntary, really to provide those prevention outreaches to the families who might be at risk of abusing or neglecting. So in 2024, our unit received 253 CPS reports, and that included 408 alleged victims. Of those reports, 71 were screened in for initial assessments or the investigations of the abuse or neglect. We also received 75 reports for child welfare for those services, those prevention type cases, and 63 of those were screened in to offer supports or services to families. Usually, the majority of those, which you can see here, are screened in those services ones. And then we have our youth justice system. So that works with youth who are 10 years or older, who have committed what would be adult crimes. Those get referred to us by law enforcement, and we process those, and if it meets criteria to go through the court process, we really try to work with them and provide services to them so they don't reoffend in the future when they are adults. In 2024, there were 31 youth justice referrals, 13 were counseled and closed, and 16 resulted in a formal petition with the court. End of 2024, 2 of those cases were pending with the court at that time. And that leads me into our youth empowerment services, so our YES program, which our youth aid worker has really, this has been his main program that he works with. So it really provides opportunities for youth to develop those life skills and supportive, positive relationships with other peers and adults in the community. He does run a YES program in the summer for those youth. You know, they do a lot of community outreach, so they'll go to the fire department, or they'll go to, they went to Cornerstone last year, Cornerstone, the auto repair shop. Really just trying to get those youth out engaged in the community, doing a positive thing. And so last year in 2024, there were 8 youth that were in that program. We also have foster care, kinship, and subsidized guardianship within the Child and Youth Services unit. So when we have to remove children from their home, we try to look at family. Now, any family, kin, who can take placement of these children. However, at times that's not possible, so we have to look at foster care. And kinship would be with those relative type placements that would receive the funding. And in 2024, Richland County had 0 foster homes licensed. We still have 0 foster homes licensed. However, we really did increase our outreach and try to promote foster care licensing community, so that foster care worker is really trying to talk with other counties and seeing how they're promoting this type of outreach, because it's really needed in our community and we just don't have it. It's really needed in the state, honestly. And then in 2024, Child and Youth Services filed for 1 guardianship, 2 termination of parental rights, and there were 21 ongoing kinship and non-subsidized guardianships in 2024. And of those, 3 closed or aged out, so 18 of those remained open. Wow, if there's any questions?
Thank you.
So community support program with daily contact would be effective from youth to seniors.
Typically, it's a adult program. Typically, it's an 18. I don't think that they serve youth. I think it's an 18 to end of life. I think primarily because they do have the youth system that is set up to provide those supports and services for them.
Still few staff for a crisis. Members, youth. I would think. Very playful, is what I'm saying.
Yeah.
When did we last have some licensed foster homes?
I honestly don't know. I mean, I've been in this unit since 2018, and well, there might have been 1 at that time.
Okay,
There might have been 1.
my goodness. So most of these kids are getting placed outside of our county if it's not kinship?
Yes, yeah, so we really try to do what we can
Are
to.
there other counties that are struggling this much? I just trying to.
Yes, I mean, it's statewide, but the surrounding counties do have licensed homes. We really try to do what we can with
Yeah.
safety planning. Safety planning allows for us to keep them in the home with their biological family or the family that they could be removed from. So we try to do what we can to keep them in their home. That's not always possible, so.
But I know Lacrosse, Crawford, Vernon, each have a staff or staff members dedicated to doing foster care. So I think for Vernon and Crawford, they have like, their staff member is like 60% of their time is as a foster care coordinator, and the remainder of their time is really just to kind of help with overflow of other duties. But she does have the ability to dedicate so much more time to the recruitment, and
That's kind of what I was trying to get at,
Find
like
more
what is our
I think that's
struggle?
one of our struggles, is that it's the time. Because Jessica, who does the foster care, is also a full-time worker and has a
Right.
full caseload. Yeah.
Questions?
Do you do a lot of like the kinship, where you like, you might place them with the grandparents or the?
Yep.
Yeah, okay.
Yep. And we try to,
There's a lot of that in Richland County right now.
yes, yep. We try to do that. If, like I said, we try to do the safety planning to keep them in the home with their parents. That's not possible. Our next step is the family who they can have that relationship with. So typically grandparents, aunts, uncles.
Thank you.
Yes.
Great. Last but certainly not least, Public Health Unit, Brandy.
Thanks, Ingrid. My name is Brandy Anderson. I am the Public Health Manager for Richland County, and I'm also a local health officer. It's my other title. I am a registered nurse by training. I'd like to highlight first my staff. As Trish pointed out, we are a smaller staffed public health unit. We are a level 2 health department. We get that designation through our 140 review, which is highlighted. That was done in 2024. So that's a pretty big deal for health departments. We do that process every 5 years, and we passed that successfully last year and presented on that at the time. But I'd like to shout out to my public health unit. Evan Ewing is a public health specialist. He's also a certified health education specialist. Brandon Alexander is a public health specialist. He was a former crisis worker here at Richland County. And then Betty Nye is a public health nurse. She is a contracted nurse that helps us in our unit. And you know, I think my leadership style is a very shared leadership approach. We have a very small unit with, we have to do a lot of different activities. And so we spread ourselves out among all those programs, and they're cross-trained in many of the things we do here in this report. So I can't say enough about my staff and how much they help us and help our county. So just an overview, in 2024, as I mentioned, we passed our 140 review. It's a very important review for local health departments. We also implemented what's our CHIP, or our Community Health Improvement Plan, last year. I'd like to give credit to Evan Ewing for being the lead on that work. He implemented a mental health work group in May and has monthly meetings with that. Just to back up for those of you that may not be familiar with that, we're required to have a community health assessment every 5 years. That's our cycle. It's 3 to 5 years, and we're on a 5-year cycle here in our county. That process was started in 2022. Our community health improvement plan was published in early 23. And then, like I said, Evan took the lead and initiated that, say around April or May of last year. May is when it kicked off the meeting. So that's going really well. Evan does the mental health work groups. Those are remotely. They created surveys for businesses. The main objectives for our community health improvement plan are mental health and substance use reduction. So we also partner with our local Partners for Prevention Coalition and the alcohol work group specifically for that piece of it. Evan has also presented at different community events, tried to promote this work that we do, and he's also started to be a guest on the WRCO morning show quarterly. So he's done a lot of work as far as being health promotion and our community health education specialist. So goes above and beyond in many ways for our unit that way. Preparedness and response. So as we go through these are essential services that public health departments have to provide. and maintain that level 2 status. There's different levels. We are level 2, as I mentioned, some health departments that are bigger and have like more staff and different degrees or specialties are like the level 3s. There's not many level 1s in our state, and that does kind of affect your funding as well. Preparedness and response is an essential activity that we have to be part of. Our biggest, we have to do what's called a functional exercise every year, and our biggest functional exercise that we provide are mass vaccine clinics in the schools. Those are flu vaccines. We get that as a state supplied vaccine from the state, and do a lot of coordination early in the year. Actually, right now is when we book our vaccine for that. We offer that to all the counties in our or all the school districts within our county. So all public health staff in my unit are helping with that on some level or another, whether it be vaccine inventory management. Betty and I give the immunizations directly, just the coordination and promotion of that. So that's our biggest one. We gave 164 flu vaccines last year. That was down from previous years, unfortunately. I'd also like to say that we also have assistance with our work from some of our regional partners. Sauk County also assisted us with one specific school district with Weston because they border our county, and they helped us with nursing resources for that clinic. Touching on immunizations, a shout out to Betty Nye as well. Again, she's our contracted public health nurse. Even though you can see that it says overall we were down in from 23 to 24 immunizations, that's largely due to the COVID and flu vaccines. I will say that our other immunizations, the numbers were up for what's called vaccine for adult and vaccine for children. Those are the state funded vaccines that we receive. And we did give more doses within our clinics. We have monthly VFC, VFA clinics. And Betty has done some outreach specifically with like our Amish population. We gave more MMR, that's the measles, mumps, rubella vaccine, and the varicella vaccine, chickenpox vaccine last year, as well as the Tdap, which is your whooping cough or your pertussis vaccine. So really proud of that. I highlighted in there, we went from 46 to 118, as I mentioned, of those VFC, VFA vaccines. So really proud of that work specifically. We give vaccines to prevent communicable diseases. So we do have to, we're required by law to follow up on communicable disease case reports. We receive those reports from local hospitals and labs, doctors' offices, etc. All public health staff are trained to respond to this. We have a specific program where we receive these reports, and we, depending on the nature of the disease or whether it's like a category 1, 2, or 3, category 1 or would be more of like your tuberculosis and your measles and very things that we have to address right away. Category 2 diseases are more of your like your Lyme disease reports and some of those like your waterborne illnesses, like your food poisoning type diseases that we also follow up on. So as you can see, in 23 we had 755, and actually in 24 overall we decreased to 718 reports within our county. Along with that, we do TB skin testing to help screen for tuberculosis disease specifically. That we have a lot of adult family homes, senior living in our county, and many of those employees are sent to our health department for TB screening. We do TB skin testing. And again, shout out to Betty Nye, who helped with a lot of that TB skin testing along with myself last year. We went up from, we gave 198 total TB skin tests in 2024, which is an increase. I'm very happy about that we were able to screen that many people. Sometimes as a result of that TB screening and along with reports from doctors' offices, we get what are called positive TB reports, which is called latent TB infection until you can determine or rule out active tuberculosis. So sometimes people are infected with what's called latent TB and they have the germs in their body, but they're not actively infectious. So sometimes we do have to respond and treat people for that illness. And last year we had to access our TB dispensary one time to give medication for that latent TB infection. That is down from 2023, thankfully. So rabies prevention and control. We get animal bite reports from our local law enforcement, usually the Sheriff's Department or the Richland Center Police Department. Our numbers went down from 2023, where we were down to 53 cases of animal bite reports in 2024. Some of the animals that we receive, or the animal bite cases we receive, aren't just your cats and dogs, but sometimes we get often reported like a bird in the house. So sometimes we have to authorize what's called fee exempt testing, where these specimens are sent to the state lab of hygiene because skunks, bats, and raccoons are the biggest carriers of rabies disease, which is fatal in humans and animals. So we do authorize fee exempt testing for those specimens. We had one bat test positive for rabies in our county last year, which is interesting, but not common, thankfully. So, Evan Ewing promoted what we labeled a Fight the Bite campaign last year. So also preventing animal bites. You know, he gave some education about how to just he encompassed like animal bites and like your tick-borne illnesses, like the diseases that are transmitted by ticks, or like your Lyme disease, anaplasmosis, or ehrlichiosis are some names of those. So he did that last summer. He dispensed some fun little kits to the YES program in the Children and Youth Services unit. And that was a really successful campaign. And he also presented that on WRCO as well. Our maternal child health program, we receive referrals from the hospital to go visit families that have new babies. And we can call and offer a home visit, a supportive visit, to give resources and referral. That's largely between Betty and myself, as we're the nurses, the clinicians in our unit, to do that. But we also provide birth packets to all new families of Richland County that are reported to us. We streamlined our education and packets last year for that, implemented some QR code and some digital stuff, resources within those packets, because we have a lot of families that use that. So we also participate in the Richland County Breastfeeding Coalition quarterly. And we created, among the coalition, it's hospital, public health, WIC partners. We were able to create, Evan actually created this tool for the coalition, a breastfeeding resource for our county. So that's going to be shared from the hospital and from all of the partners at that table. So we were happy with that work as well. Environmental health. We, unfortunately, in 2024, it was the first year that we did not have the environmental health coordinator that had been here previously for 21 years. His name is Troy Morris. We employed him previously from Grant County as a coalition. That changed, and in 2024 was the first year where just Richland County public health staff did that work ourselves. We did get some consultation from him from time to time. He still helped us with some cases as far as just a consultation, but we went on all the home visits that were required for us to do so. Some are more significant than others. As you can see listed in the report, those are the types of things that get reported to us. We do get a fair amount of mold types of calls that are take seriously, but they would say they're less critical sometimes. Often we get some landlord tenant type of dispute type of calls. And so we do refer people to DATCAP for some of those things. Sometimes and often the things that we do have to respond to are the unsafe, unsanitary condition type of home visits, and we do make home visits for that, and then provide recommendations, and less commonly what are called abatement orders that people have to act upon to correct those conditions to make their home healthy and safe. We had 32 total home visits last year amongst public health staff. And just to point out, that's again a newer process for us to do within our own health department. And I just really applaud my staff for digging in and just kind of getting these new processes figured out. We created a digital documentation tool for those visits. We also, just this year, created a screening tool to help streamline our work and help guide our work. That environmental health, we operate off of state statute and our local ordinance codes for that. We do follow up on private well testing reports. People can obtain some fee exempt test kits at our health department. Some are for purchase, depending on your circumstances. We also dispense radon test kits. We are part of the Southern Region RIC Radon Information Center program. Troy Morris is still our RIC coordinator for that. We did dispense 46 radon test kits with a 29 test kit return rate last year, which is pretty good. Another environmental health concern is lead poisoning and prevention. Specifically in children, we have to follow up on these reports. We had 18 reports that we had to respond to and follow up on last year as far as elevated lead levels in kids. And we do have a mechanism, a program for that as well, that those get reported to us from providers. We participated and started, there's a lead and water testing and remediation initiative that was offered by the state, and we started that last year. We were able to test one daycare fully in 2024 and go out and test all the faucets. And what happens is then the state will help provide like the remediation. If there's any faucets or things that need correcting, then the state will take that. These are the licensed daycare facilities in our county. We've now gone on to our second daycare facility. It's been offered to all the daycares. The second daycare facility, we just collected all those samples here in April. So a little bit of a slower process, but we're really hoping to move forward. And our goal is to get all the eligible daycares in our county tested. So, and then we also dispense from the public health unit. And again, the main front desk staff helps with this over at our agency, loan closet supplies. And you can see the numbers there from 2024. We also collaborate a little bit with the Richland Community Free Clinic on vaccines. Specifically once a year now, we try to still promote a Spanish speaking, because that's a lot of the clientele at the free clinic are Spanish speaking. So we try to coordinate a day where we can go bring our VFC and VFA vaccines over to the free clinic or 2 days. So there's still some collaboration there amongst the staff at the free clinic. I'm trying to think. I think that's all I have for now.
Thank you, Brandy. Yes,
I have a
Mary.
question going back on page 34. I looked at this the other night. I was concerned about this polio business. Is that Richland County? Or were these statistics from other counties? Because it went from 1.
Page 34. Oh, the immunization. So we provided 9 polio vaccines specifically.
So we didn't have an active.
We didn't have that.
Okay.
No,
that's
ma'am.
what I wanted to know.
Yes,
Thanks.
Sandy.
On page 38, for environmental health, waste accumulation. What do you mean by waste? Is it like just junk around or,
Sometimes organic material, trash.
but like no rusty old vehicles or gas or anything like that that could be?
Not usually. We had one site specifically that did have, like tires. It could be tires too. Because tires can harbor water and then mosquitoes. Then that can breed disease or create circumstances where they create disease.
I was just wondering.
Sometimes the waste, so with environmental health, some of those things that we're learning can be quite tricky, and some things fall under, like, for example, like weeds or like cars. Sometimes that's more of like law enforcement type of enforcement and tickets for that from that agency. So
Like DNR or something?
sometimes, yep, and I should have mentioned and I forgot to, but we do collaborate with the DNR, with DATCAP, with zoning, city and county zoning, local law enforcement often, and other units.
Thank you.
Yeah, you're welcome.
Dan?
We're curious if you get a child or an adult that is, say, at a visit to the doctor has lead in their system. Okay, how does that report get to you? And at that point, what does the county do to remediate the problem?
Sure. We're not required to follow up on adult lead. That's not a requirement for us. So we don't get the adult lead reports. For children, we have a mechanism. It's a program called HELPS, for short, HHLPS. And what doctors do is it's a digital mechanism of reporting, but sometimes we get specifically phone calls, but often it's digital reporting through a program. We get an alert. It comes through as an alert that you have an elevated lead level. And this can be just even over that, that threshold, just slightly elevated. So we have an algorithm, and depending on where they fall with their level, then it guides us into what kind of follow-up we have to do with the client. We're always calling the doctor's office to confirm, that's our process. We're always calling the families to make sure that they're aware and that they understand that they had a child that was tested positive for lead. And then we go from there. So often what happens is if it's low enough, we just wait and retest and give education, hand washing, good nutrition, because sometimes a low enough lead level, you can reduce that. It can go away with those things. Good nutrition, hand washing, reducing the exposure of lead. If it gets to another level, a higher level, then nursing and environmental health, we go out and do a home visit and we look at the home and we have a checklist to see like where those sources of lead are. Interestingly, there are certain spices imported that we're seeing on lists now. There's certain like old pottery. Sometimes you get things like high chairs that are painted with old lead
Like
paint.
what things?
High chairs,
Oh,
like
really?
old antique chairs, that we've seen that a little bit. And then often it's just an old home, usually that they're doing construction or they're renovating. That's often the most common source of lead paint, is they have peeling old lead paint or they're doing some home renovation. So then usually the source of the lead just goes away. We provide education, you know. We haven't had, knock on wood, any critical values. If it's very critical and very high, then we're calling the doctor's office. We're getting them into ERs. We're getting them sent for what's called like chelation therapy and things that are more critical and immediate. But knock on wood. So it just really depends on where they fall with their level. A lot of retesting, a lot of education, and a lot of collaboration with doctors' offices and then the clients themselves. So
If the family was, I have some, a friend of mine up in Oshkosh and knows a family. They were moved out of their home into a motel for actually almost 4 weeks. And now who pays for that? Does the county pay for that? They had to go through the house, basically gutted it.
sure.
And who pays for that?
So the state had, and I just had an EH consortium meeting yesterday with Troy. So the state did have what's called an L-SHIP program. So if you meet certain qualifications, we had one family here that met that qualification. I believe that was 23, where you have to have the state come, and if it's bad enough and the lead's not getting corrected, somebody that's certified by the state has to come and do what's called a lead clearance test. That's where you come in and you do like extensive swabbing of the home and wipes and certain things, send those off to the state. If the home doesn't pass the lead clearance test with that child, then you have to do some remediation, and who pays for it gets very tricky. It depends on if it's like, it's a renter, basically who owns the home. But the L-SHIP program did help offset, I believe, some of those costs for families in previous years, but I don't know what that funding looks like for future fundings.
Okay, thank you.
It can be costly. Thank you.
Thank you. Anything else?
You know, I haven't been through the budget process for the county yet, but each of these programs is so impressive, but yet they're underfunded, right? So I guess my question is, what's our role for this upcoming budget in this? Because I think it's going to be tense because of decreased federal funding, possibly. So I'm just trying to figure out what's our best strategy for ensuring good services and processes for the committee to do that.
So how the budget process will go is that Stephanie and her new financial manager will work with each of the managers and draft a proposed budget. It'll then come to me. I'll review it, work on it with them. We'll look at what we can afford through the whole county, because it's countywide that there are beneficial programs that are underfunded. And so it's really about how do we prioritize, where does the limited amount of funds go? Typically how HHS has done it is they then bring it to you as a draft budget. And so that you have the opportunity to look at it, review it, give some input, but ultimately it is up to the administrator to present a final budget to the full county board. So
So
that,
that draft budget would have to come here first?
That's what we typically do, yeah.
All right. 'Cause I was just thinking of future agenda items. What might be good questions to ask to help the staff get there?
I would say
Without
you guys
being-
have done a great job with the budget process the last couple of years. It's been smooth from my perspective.
yeah, it has. And it is hard. It's hard because there's never enough money. And it's really trying to set those priorities, trying to be creative. One of the things that some counties do across the state is they do some of their APS work and they build crisis. Sometimes they create CCS workers to provide some of the services. Those are things that we haven't expanded on yet. They were going to be goals of mine for this year to go into 2026 budget. So I think sometimes it's not about getting us extra money, but being creative with the funds that we do receive.
Good question, though. All right, I just want to say again, thank you to all of you. Been on this board for a while and it's just such a privilege to get to hear and learn about the depth and complexity of all the services that you guys do and the hard work that you put into it. I wish that everybody in our community had a chance to learn those things. I think a lot of people just don't realize how much this department as a whole works for our community and how much goes into it and what there is available. So it's a privilege to learn about that. And I just want to say thank you from me and my family who live in this community for all of your guys' hard work. So thank you again. Number 9, correspondence.
Before you do that,
Yeah.
I went down here I wanted, this paternity establishment,
Which page are you on?
I'm on page 40.
Through the child support information, Mary?
Do I have, yeah, child support.
Okay.
Yeah. This number 2, paternity establishment. It used to be that a young lady could have a child
Thank you guys.
and not mention who the father is. Does that still happen?
Yes, and I'll let Brianna stick around a little bit. So, yes. Somebody is allowed to have a child and not name who their father is, but if they receive public benefits, then they are required. If they receive Medicaid,
Right.
then they are required to cooperate with child support in establishing paternity.
That doesn't mean that there's still anybody gonna pay, right? If they don't, if they aren't here, right, I suppose they have to pay if they are.
Yeah, if they are
coming here.
to establish paternity, depending on how what the situation is. They may then be required to pay child support, or it could be, and you can, this I don't know for 100% certainty, they may have to help pay the labor and delivery costs, but may not be required to pay child support after baby's born,
Yeah,
maybe.
I'm not for sure on that.
Yeah.
I just know that in order to be eligible for the healthcare benefits, they do have to cooperate. Unless they have a good cause, which means if they're fleeing domestic violence, they would have to provide police reports and to prove that. But yeah, they do have to cooperate in order to be eligible.
I know, it's been a question around for a long time. Why somebody isn't paying.
Why they aren't paying? Yeah,
Why someone isn't paying.
I don't know that.
I think it can be a multitude, like she talked about, Melanie talked about, if they're in jail, they're not required to pay. If they're in a treatment facility, they're not required to pay. It could be that if they are receiving Social Security, like SSI, they're not required to pay. So those are individuals who have their own disability and don't have the ability to work. They are not always required to pay. It could be if, just trying to think of what other ways, or if they're just not working, then they're required to pay, but it doesn't necessarily mean that they pay. Does that kind of answer your
Yeah,
question?
but that seems like it'd be a lot on the county too, if you aren't getting paid for stuff. And it goes right up the line too.
Yeah.
Okay, thank you.
Did we have any correspondence?
No.
No, okay. Future agenda items, anybody on the committee or HHS? Add anything?
Probably for June.
When do we do our, is that July? that
July
we do
is the budget,
the
public.
The public
hearing is
forum or
July. Yeah,
hearing?
it's July.
Okay.
I don't know if I'll have any 2026 budget, like, expectations that I've received at all by then.
Okay.
I mean, you could put 2026 budget planning in there.
Okay.
I mean, you know,
Let's see where we're at.
I can give you an update.
Right. Anybody from the committee? Okay, so we will adjourn until, I never remember to look up the date for the next, be June 5th. Right.
Back on board now for first Thursday, Ingrid?
Yes.
Yes. Do I have a motion to adjourn to June 5th?
I'll make the motion.
Thank you, Sandy. And a second?
I'll be.
Mary Miller. All those in favor, please say aye.
Aye.
Any opposed? All right, thank you, guys. This is a longer than normal meeting because of the annual report. They're not,
Very impressive.
yeah, not this long, but what's that?
2 hours long.
Yeah,